Hello, everybody. Welcome back to another day and another episode in Radiology. Today is Radiology number 38, actually. And we're going to kind of continue the same path we've been doing for the past few videos now, which is exploring the different medications given in an ICU or other critical care scenario or department. And we'll be doing just that. If you haven't liked my videos, please go ahead and subscribe, as it means a lot. Without further ado, let's get started. So, just like always, we're going to have the slide up here. You don't have to essentially know this by heart right now because we haven't gotten to that yet. If you look at some of my past videos, though, I do explain a little bit more deeply because we've kind of been in that radiology phase, been looking at x-rays. So, you don't feel free to not really understand this. But I would say if your curiosity kind of piques you, then definitely take a look at some of my further videos back, and you can kind of get an understanding of how we can use X-rays to identify different causes of problems and treat them accordingly. So today's topic is going to be the medication called beta blockers. Now I kind of want to explore this topic because it's really connected to the cardiovascular system and also the endocrine system, as you can see in this picture I put up. What beta blockers do is they act as an inhibitor, preventing these adrenaline molecules from binding to the receptors as shown. And because they take the place of that receptor, that means that adrenaline can't actually bind, meaning that it doesn't fully get released or it's not successful release. Now, typically what would happen is adrenaline would kind of come in and it would increase heart rate because it activates the sympathetic nervous system. Now, this patient has some stents in the cath lab and everything like that, and everything's going well. However, in order for his heart to fully heal, in order for like the dead tissue and kind of the weak imbalances in the heart to now kind of regrow and reapportion themselves, it kind of needs a stimulus. Now, normally when the heart kind of rebuilds itself, it doesn't do so effectively because it builds on scar tissue and it just doesn't help the blood flow as efficient as normal muscle. So, what's sometimes given as like a last option is something called beta blockers, which block these adrenaline molecules, just like we talked about, and they help prevent heart rate and blood pressure. Now, what this does is put less stress on the heart, and these beta blockers also work by basically helping aid the heart in the recuperation process. However, the one major problem with beta blockers is their effect, right? While it does reduce the stress on the heart, it can also cause issues with blood pressure and heart rate, leading to bradycardia and hypotension, which basically doesn't allow blood to be as efficient, blood flow being efficient throughout the human body. And that's a problem because if blood doesn't flow, blood clots are going to happen and oxygen isn't going to be delivered. There's a whole lot of problems with blood not flowing. And that's kind of a risk of using beta blockers because they're so aggressively block adrenaline. They keep the body in this like calm and relaxed state to kind of heal. But it's dangerous because that low and relaxed state could become a problem, although it is slightly more rare. And that's kind of why I wanted to give you guys this new thing to learn about because I found this to be really fascinating because of how many different systems it connects together and how it's a really cool solution essentially to treating people who have undergone complex heart surgeries or want to kind of have the better heart health. So hope you guys enjoyed this one, and we'll continue talking about various different medications and so on for critical care in another video. Please consider liking and subscribing. Bye bye.